Hi everyone, today I'll be talking to you about nightmares, what they are, as well as how do we treat them using evidence-based strategies. My name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and I've been studying and practicing evidence-based mental health for the better part of a decade, and I'd like to share some of that information with you. So I want to start with talking about what is nightmare disorder. So nightmares are essentially these vivid, disturbing dreams that usually are very negative in their content. So for example, it might be someone chasing you or attacking you, or you're in a really disturbing situation and you're feeling anxious and dysphoric. And the unique thing about nightmares compared to more stressful, vivid dreams is that nightmares actually wake you up, and then you kind of feel very anxious. And then as a result, you sometimes have a difficulty falling back asleep because of the anxiety that came from the nightmares. And nightmare disorders, usually this is kind of defined by the frequency and the prevalence of it. So nightmare disorder usually requires at least once a week where you're being awakened by these nightmares. And of course, it causes a lot of distress both in the nighttime and fear maybe during the daytime about having another nightmare. So when I'm treating nightmare disorder, I usually like to talk to patients about the story of Jessica and the wolf. So Jessica was a 9-year-old girl where essentially she would have recurrent nightmares about a wolf chasing her at night. So she'd be going to bed, and then all of a sudden she'd be running through the forest and the big bad wolf was chasing her, and she'd run and run and run, but eventually the wolf would catch up, attack her, and Jessica would wake up. And of course Jessica would be very, very anxious. She'd run to mom and dad and be like, "Mom, dad, like this is always happening. What can I do to stop this wolf from attacking me?" And mom and dad smile with sort of wisdom and say, "Actually, Jessica, you know what? We have something for you. Here's a magic wand for you, and I want you to practice throughout the day using your special spell to turn the wolf into a small little bunny. So Jessica, I want you to go through the day and use this specific phrase called abracadabra. And the important part is I want you to keep practicing it so that when the wolf attacks you, you're ready to turn around, use your magic wand, and say abracadabra to the wolf and turn them into just a nice little bunny." So Jessica does exactly what mom and dad says. She goes through her day and she constantly is practicing using her magic wand, such that by the end of the night, when the wolf came to attack her, it's running and running at her, she turns around, bravely says abracadabra, and the wolf turns into a little bunny, and the wolf never bothered her again. So at the heart of the story of Jessica and the wolf is an evidence-based technique known as Imagery Rehearsal Therapy. And Imagery Rehearsal Therapy is essentially you're taking a nightmare that you recently had or you remember really well or you always have, and you're writing it down into a script, providing enough detail that if like a movie director took your script, they'd be able to create a reasonable representation of what happened. And then the secret is that you then write another script that changes parts of the story, or all of the story, into one that has a more positive ending. So just like Jessica and the wolf, instead of the wolf attacking and eating Jessica, so to speak, she would change it so that she had a magic wand to be able to change the wolf into a harmless little bunny. So to just give a couple examples of what imagery rehearsal therapy can look like, one of my patients was having reoccurring nightmares about an avalanche that was coming to crush her and everybody else, and she was with a lot of people, but there was only one getaway car, and the car was pretty small, so it could only take her dad who was driving the car, her, and a few other people, and everyone else got crushed. So in our imagery prescripting, what we did was that we made the car big enough so that it could take everyone with them. And I also asked her as a silly suggestion to be the person actually driving the car instead of her dad, so that it would give her a sense of self-efficacy and autonomy in being able to resolve her problems. So in this particular story, we only rescripted part of the ending to make it more positive and give her a sense of autonomy, but sometimes you can also just change the entire nightmare. Like one of my other patients had nightmares about needing to leave their dog at the kennel, and instead of that particular nightmare, we simply rescripted the entire thing so that she was spending time with her dog and her family at a nice pleasant lake and just enjoying a really wonderful dream. So imagery rehearsal therapy sounds kind of like a silly technique, but in reality they can be extremely powerful. So both of the patients that did this imagery rehearsal therapy saw a complete reduction in the amount of nightmares they were experiencing, and the first patient even got a sense of self-efficacy where they were like thinking, wow, like this strategy was so helpful, it kind of made me think more about during my day how I can cope with different situations, how I can problem solve. So it even gave her a sense of autonomy. So I definitely encourage you to give it a chance to practice imagery rehearsal therapy throughout the day, where once you've written out your rescripted nightmares, so the positive one, what I encourage you to do is to take some time at night, in the evening, to really read it over at least a few minutes every day, and to even close your eyes and see if you can visualize it. Visualize all the emotions that come with it, the situation, and really give it a chance to really lock in your day, so that during the nighttime we can see just how much of an impact it can have on your sleep and your nightmares. And that's imagery rehearsal therapy. If you found this video helpful, I encourage you to subscribe, because I'll be continuing to talk more about evidence-based mental health and sleep down the road. Take care.